Something quietly significant just happened in Ottawa. And if you're a Canadian senior, if you're approaching retirement, or if you're caring for aging parents, this is information you need right now. Because starting in 2026, the federal government is rolling out changes to the Canadian Dental Care Plan that could fundamentally alter how millions of seniors access oral health care in this country. We're talking about coverage that was previously unavailable through public programs, coverage that many seniors have gone without for years, sometimes decades. But here's what's generating concern among policy analysts and retirement planners. The eligibility rules, the income thresholds, and the coordination with provincial programs are creating confusion. And that confusion could cost some seniors thousands of dollars if they don't understand exactly how this works. My name is Joseph, and over the next several minutes, I'm going to walk you through exactly what's changing, who qualifies, what this means for your retirement income, and the critical steps you need to take before this launches. Because this isn't just about dental care. This is about understanding how government benefits interact with your CPP, your OAS, your taxable income, and your overall retirement security. Let's break this down. To understand what's happening now, we need to look at what's been developing quietly over the past 18 months. The Canadian Dental Care Plan, officially launched in phases starting in 2024, represents the most significant expansion of federal healthcare coverage in a generation. The government initially prioritized children under 18, then expanded to adults with disabilities and lower-income Canadians. But the senior phase? That's where this gets complicated. Oral health among Canadian seniors has been a policy concern for years. Statistics Canada data shows that approximately 22% of seniors aged 60 and older have completely avoided dental care due to cost. For those living on fixed incomes, relying solely on CPP and OAS, dental expenses represent a catastrophic financial risk. A single root canal can cost $1,500. A set of dentures can run $3,000 to $5,000. Periodontal treatment, extractions, crowns, these aren't luxury procedures. For seniors, oral health is directly connected to nutrition, chronic disease management, and overall quality of life. Until now, unless you had private insurance through a former employer or a spouse's plan, or unless you qualified for limited provincial programs, with extremely restrictive income caps, you paid out of pocket. That's the landscape that's shifting. Health Canada confirmed in late 2025 that the senior enrollment phase would begin in early 2026, with coverage taking effect for eligible individuals born in 1961 or earlier. The government estimates this will cover approximately 1.7 million Canadian seniors in the first full year alone. But here's where retirement policy analysts are raising questions. The income threshold for eligibility is tied to adjusted family net income, and that creates immediate complications for seniors receiving CPP, OAS, GIS, RRIF withdrawals, and investment income. Because if your household income crosses certain thresholds, you don't qualify. And those thresholds are lower than many seniors realize. Let me explain exactly how this program works, because the details matter enormously. The Canadian Dental Care Plan for Seniors operates as a federal insurance program administered through Sun Life. It covers a range of preventive, diagnostic, and restorative dental services. Covered services include routine cleanings and examinations, x-rays, fillings, extractions, root canals, dentures and partial dentures, periodontal treatments, certain oral surgery procedures. Now, this is not unlimited coverage. The program uses a fee guide that sets maximum amounts for specific procedures. Dentists can choose whether to accept the plan's payment as full compensation or charge patients additional fees. That's a critical distinction we'll return to. Here's the eligibility framework. First, you must be a Canadian resident with a valid social insurance number. Second, you must not have access to dental insurance through a private plan. This includes employer-sponsored coverage, retiree health benefits, or insurance through a spouse's plan. If you have any form of private dental insurance, even limited coverage, you are not eligible for the Canadian Dental Care Plan. Third, and this is where it gets financially significant, your adjusted family net income must be below $90,000. Let me repeat that. If your household income, combining your income and your spouse's income if you're married or in a common law relationship, exceeds $90,000, you do not qualify. But there's more complexity. For those with household incomes under $70,000, there are no copays. The government covers the full cost of approved procedures up to the fee guide limit. For those with incomes between $70,000 and $79,999, you pay a 40% copay. For incomes between $80,000 and $89,999, you pay a 60% copay. So even if you qualify, your out-of-pocket costs vary dramatically depending on where your income falls within that range. Now, let's talk about what adjusted family net income actually means, because this is where many seniors get tripped up. This is the figure from line 23,600 of your tax return. It includes CPP retirement benefits, OAS payments, employment income, RRIF or annuity withdrawals, investment income, dividends, and capital gains, rental income, any other taxable income. For a senior couple both receiving maximum CPP and OAS, that's already approximately $37,000 to $40,000 combined before any other income sources. Add modest RRSP withdrawals, some investment income, or part-time work, and you can approach or exceed the threshold faster than you might expect. This is where retirement income planning intersects with healthcare access in ways most Canadians haven't had to consider before. So who exactly benefits from this program and who's being left out? The primary beneficiaries are lower income and modest income Canadian seniors who have been priced out of dental care for years. This includes seniors living exclusively on CPP and OAS, with minimal or no additional income, widows and widowers who lost spousal employer benefits and are now on fixed government pensions, seniors who spent careers in industries without dental benefits, retail, hospitality, personal services, small business, those who exhausted their retirement savings due to medical expenses, housing costs, or supporting family members, single seniors who tend to have lower household incomes than senior couples. These individuals often avoided dental care not because it wasn't needed, but because a $200 cleaning or a $1,500 crown represented weeks of grocery money. But let's be clear about who this doesn't help. If you're a retired public servant with a comprehensive retiree health plan, you're excluded. If you worked for a large corporation and retained dental coverage into retirement, you're excluded. If your spouse has employer coverage that extends to you, you're excluded. And critically, if you're a middle-income senior couple, both of you receiving CPP and OAS, modest RRIF income, perhaps some dividend income from a non-registered portfolio, you may find yourself just above the $90,000 threshold and completely ineligible. This creates what some policy analysts are calling a benefits cliff. You could have $89,000 in household income and receive full or partial coverage. At $91,000, you receive nothing. There's also concern about seniors in the so-called missing middle, those who don't qualify for GIS because their income is too high, but who also don't have employer pensions or private dental insurance, and now find themselves above the Canadian Dental Care Plan threshold. These are individuals who planned carefully, saved in RRSPs, and are now being penalized for modest retirement income that disqualifies them from new government support. Let's talk real numbers, because that's what matters in retirement planning. For a senior who qualifies with household income under $70,000, this program could save between $500 and $3,000 per year, depending on their dental needs. Consider a 68-year-old woman living on CPP and OAS. Total income approximately $24,000 annually. She needs 2 fillings, a cleaning, X-rays, and 1 extraction. Under the old system, out-of-pocket cost, approximately $1,400. Under the Canadian Dental Care Plan with zero copay, $0. That's $1,400 she can now allocate to food, utilities, medication, or emergency savings. For a senior couple with combined income of $55,000, both receiving CPP and OAS plus modest RRIF withdrawals who need routine preventive care and occasional restorative work, annual savings could range from $800 to $2,000. But now consider a couple with combined income of $78,000. They qualify, but they're in the 40% copay range. Same dental work, 2 cleanings, x-rays, 3 fillings, 1 crown. Total cost under the fee guide, $2,200. Their out-of-pocket cost with 40% copay, $880. That's still significant savings compared to paying the full $2,200, but it's not the relief that lower-income seniors receive. And here's a scenario generating real concern. A widowed senior, age 72, living on CPP, OAS, and income from a small RRIF. Total income, $48,000. She qualifies with no copay, but her financial advisor recommends a $15,000 RRIF withdrawal to cover a necessary home repair. That year, her income jumps to $63,000. Still under $70,000, still no copay. The following year, she needs another $20,000 withdrawal for a medical expense not covered by provincial health insurance. Now her income is $68,000 for that tax year. Still qualifies. But if she had needed $25,000, income hits $73,000, and suddenly she's paying 40% copays. This is the kind of income volatility that retirement planners are now having to account for when advising clients on RRIF withdrawal strategies, investment income timing, and even whether to delay CPP or OAS. And there's another financial consideration that's not being widely discussed: the interaction with the Guaranteed Income Supplement. GIS recipients, seniors with the lowest incomes, already receive some provincial dental benefits in certain provinces. The federal plan now overlaps with those programs, and provinces are still determining whether they'll continue their programs, scale them back, or coordinate benefits. If a senior loses provincial coverage but gains federal coverage with restrictions or copays they didn't have before, that's not necessarily an improvement. So why is the federal government implementing this program now? And why with these specific parameters? From a policy perspective, oral health coverage for seniors addresses a legitimate gap in Canada's healthcare system. Unlike hospital and physician services covered under the Canada Health Act, dental care has never been universally publicly funded. The government's stated objective is to reduce financial barriers to essential healthcare for vulnerable populations. But there are fiscal and political calculations at work here as well. The program is expensive. The Parliamentary Budget Officer estimated the full Canadian Dental Care Plan would cost approximately $13 billion over 5 years. With federal deficits remaining elevated and debt servicing costs rising due to higher interest rates, the government needed to set eligibility thresholds that controlled costs while still delivering benefits to a significant portion of the target population. The $90,000 income cap is the mechanism for that cost control. It limits the eligible population while still covering an estimated 65% to 70% of Canadian seniors. There's also a demographic imperative. Canada's population is aging rapidly. The number of seniors is projected to increase from approximately 7 million in 2024 to over 10 million by 2035. Healthcare costs, including untreated dental disease leading to emergency room visits, infections, and chronic conditions, are escalating. Preventive dental care is cheaper than emergency interventions. The government is betting that by covering routine dental services now, it reduces more expensive acute care costs later. And there's a political dimension. The Canadian Dental Care Plan was a key commitment in the Liberal government's confidence and supply agreement with the NDP. Delivering on that commitment, particularly for seniors who vote at higher rates than younger demographics, carries political significance. But policy experts are watching closely for unintended consequences. Will dentists broadly accept the fee guide, or will seniors face additional out-of-pocket costs even with coverage? Will middle-income seniors reduce RRIF withdrawals or defer income to stay under the threshold, potentially creating tax complications later? Will provinces reduce their own dental programs, leaving some seniors worse off? These are the questions that don't get answered in press releases. The response from economists, pension experts, and senior advocacy organizations has been mixed. The Canadian Association of Retired Persons, CARP, has generally welcomed the program as a step toward addressing a critical gap in healthcare coverage. They've noted that for many seniors living on CPP and OAS alone, dental care has been inaccessible for years, leading to serious health consequences. But CARP has also raised concerns about the income threshold and the exclusion of seniors with modest private coverage. They've argued that the $90,000 cap is too low for seniors in high cost of living areas like Vancouver and Toronto, where that income level doesn't reflect economic security. The National Institute on Aging has pointed out that oral health is directly linked to management of diabetes, cardiovascular disease, and respiratory conditions, all more prevalent among seniors. They view the program as a public health investment, not just a benefits expansion. However, retirement income planners and financial advisors are raising practical concerns. Several prominent advisors have noted that the interaction between the Canadian Dental Care Plan eligibility and RRIF withdrawal strategies is creating new complexity. Seniors who were planning systematic withdrawals to manage tax liability and avoid OAS clawbacks now have to consider whether crossing the $90,000 threshold will cost them dental coverage worth potentially thousands of dollars. There's also concern about the administrative burden. Seniors need to apply for coverage, provide income documentation, and recertify annually. For individuals with cognitive decline, limited digital literacy, or language barriers, this creates access challenges. Provincial responses have varied. Some provinces are viewing the federal program as an opportunity to redirect resources from existing limited dental programs toward other healthcare priorities. Others are concerned about coordination gaps and are calling for clearer federal-provincial agreements. Dental associations have expressed cautious support, but emphasize that the fee guide must be realistic to ensure provider participation. If reimbursement rates are too low, dentists may decline to accept the plan, forcing seniors to pay out of pocket and seek reimbursement, a process that defeats the purpose of accessible care. What we're seeing is a developing policy landscape where the theoretical benefits are clear, but the practical implementation is raising questions that will only be answered as the program rolls out. If you're a Canadian senior or approaching retirement, here's what you need to do right now. First, determine whether you're likely to be eligible. Calculate your adjusted family net income from your most recent tax return. If you're married or common law, include your spouse's income. Be realistic about whether you're under $90,000. If you're close to that threshold, understand that income fluctuations from RRIF withdrawals, investment sales, or part-time work could affect eligibility year to year. Second, review your current dental coverage. If you have any private insurance through a former employer, a spouse's plan, or a purchased policy, you are not eligible for the Canadian Dental Care Plan, regardless of income. You cannot choose to drop private coverage to qualify for the federal program if that coverage is employer-sponsored or otherwise mandatory. Third, understand the application process. Enrollment for seniors begins in early 2026. You will need to apply directly through the Canada Dental Care Plan portal or by phone. You'll need your social insurance number, proof of residency, and income documentation from your most recent tax return. Do not wait. The government has indicated that there may be processing delays as millions of seniors apply simultaneously. Early application ensures earlier access to coverage. Fourth, if you're in the copay range, income between $70,000 and $90,000, Understand your actual costs. Ask your dentist whether they'll accept the fee guide as full payment or whether they'll charge additional fees. Get estimates for planned procedures so you know your real out-of-pocket costs before booking treatment. Fifth, if you're a retirement planner or working with a financial advisor, discuss how this program affects your RRIF withdrawal strategy, income splitting, and tax planning. For some seniors, it may make sense to defer certain income to stay under the threshold in years when significant dental work is anticipated. For others, the tax cost of deferral may outweigh the dental benefit. This requires individual analysis. Sixth, stay informed about provincial programs. Some provinces may maintain or modify existing dental programs. Check with your provincial health ministry to understand whether you have access to other supports, particularly if you don't qualify for the federal plan. Seventh, if you don't qualify but believe the income threshold is unreasonable, make your voice heard. The program is new. Eligibility criteria can be adjusted based on feedback, advocacy, and political pressure. Contact your member of parliament, participate in consultations, and support organizations advocating for broader coverage. Looking ahead, several scenarios are possible. In the best case, the Canadian Dental Care Plan operates smoothly, dentists broadly participate, seniors access needed care, and health outcomes improve. The program demonstrates fiscal sustainability, and future governments maintain or even expand it. In a more challenging scenario, provider participation is limited, administrative barriers frustrate seniors, co-pays prove higher than expected, and the program underdelivers on its promise. Political pressure builds to either expand eligibility or modify the structure. There's also the question of long-term fiscal sustainability. If costs exceed projections, future governments may tighten eligibility, increase co-pays, or reduce covered services. And we can't ignore the broader context. Canada faces significant fiscal pressures: an aging population, rising healthcare costs, climate adaptation expenses, and defense spending commitments are all competing for limited public dollars. Programs like the Canadian Dental Care Plan will be scrutinized. If a future government decides fiscal consolidation is necessary, benefits programs are often targets for cuts or restructuring. That's not a prediction. It's a reality of policy cycles. What seniors need to understand is that while this program represents a significant expansion of coverage today, maintaining and protecting that coverage will require ongoing attention, advocacy, and political engagement. The Canadian Dental Care Plan for seniors represents a fundamental shift in how oral health care is accessed in this country. For millions of lower-income and modest-income seniors, this is genuinely life-changing. It's the difference between enduring pain, risking infection, and losing the ability to eat properly, and receiving the care that should have always been accessible. But the program is not universal. The eligibility thresholds, the co-pay structure, and the exclusion of those with any private coverage mean that many seniors, particularly those in the missing middle, will see no benefit. And the interaction between this program and broader retirement income planning introduces complexity that most Canadians aren't prepared for. This is why staying informed matters. Understanding not just what the headlines say, but what the fine print means for your specific situation. Knowing when to apply, how to coordinate with other benefits, and what financial trade-offs you might face. Because in retirement, every decision about income, taxes, and benefits is connected. One change ripples through your entire financial plan. If you found this analysis valuable, subscribe to this channel. Share this video with family members, friends, or anyone in your community who needs to understand what's coming in 2026. And leave a comment. Tell me, are you planning to apply? Do you qualify? Are you concerned about the income threshold? What questions do you still have? This is a developing policy area. I'll continue following it, analyzing changes, and bringing you the information you need to make informed decisions. My name is Joseph. Stay informed, stay prepared, and protect your retirement security. I'll see you in the next one.